In this video, we will talk about Staphylococcus, that is an important bacterial species. So here is the classification of Staphylococcus. It lies in the kingdom Bacteria, class is Bacilli, family is Staphylococcaceae, and genus is Staphylococcus. There are various species of this genus, the three most important of which are Staphylococcus aureus, Staphylococcus saprophyticus, and Staphylococcus epidermidis. The important properties of this genus include they are gram-positive cocci arranged in grape-like clusters on microscopy. They are non-motile, non-spore-forming, facultative anaerobes. On biochemically, they are catalase positive and resistant to bile salts. Catalase is an important enzyme that is produced by this bacteria that causes the degradation of hydrogen peroxide into water and oxygen. So when there is breakdown of hydrogen peroxide, thus the bacteria is prevented by the killing effect of hydrogen peroxide. Some species of Staphylococcus aureus produce pigment that is staphyloxanthin that impart golden color to its colonies, while some species of Staphylococcus aureus are also capsulated. In the pathogenesis of Staphylococcus aureus, there are important virulence factors that can be categorized into cell wall associated structures, toxins, and coagulases. In cell wall associated structures, the important virulent factors are peptidoglycan that has endotoxin like properties and induce the release of various cytokines from the macrophages. Next is capsule or polysaccharide capsule that act as a protective coating of the bacteria. Next is protein A, that is an important protein in its cell wall structure that binds to Fc portion of IgG antibodies at the complement binding site, thereby preventing the binding of complements at the complement binding site of antibody. So there will be no complement activation and there will be no opsonization and phagocytosis of the bacteria. Next is clumping factor, that is an important protein in its cell wall structure that causes the adherence of bacteria to fibrinogen and causes the colonization of this bacteria at extracellular matrix surfaces. In the toxigenic category, there are various toxins produced by this bacteria that include hemolysin that causes the lysis of red blood cells, leukocidins that causes the killing of white blood cells, enterotoxin that causes food poisoning symptoms. It acts as a super antigen and induces the production of cytokines by macrophages. Toxic shock syndrome toxin that causes toxic shock syndrome basically in case of when there is vaginal and nasal tampons, and it also acts as a super antigen and causes the release of various cytokines from macrophages. Exfoliating toxin that act as epidermolytic, that means it causes the lysis of dermis, and it also causes the lysis of desmoglein in the desmosomes. Next is coagulase category that includes staphylokinase that causes the lysis of thrombi, DNases, phosphatases, lipases, phospholipases, and hyaluronidases, while the important virulence factors of Staphylococcus saprophyticus and Staphylococcus epidermidis include catalase, that is an important enzyme produced by this bacteria, beta-lactamase that impart resistance to beta-lactam drugs, and teichoic acid that is present in the cell wall and it also induces the production of various cytokines from macrophages. So the diseases of Staphylococcus aureus can be categorized into two categories, that is toxigenic and pyogenic. In the toxigenic categories, there are two diseases. One is toxic shock syndrome, that is caused by toxic shock syndrome toxin, and food poisoning, that is caused by enterotoxin. Both the toxin act as superantigen and induces the release of cytokines from macrophages. Toxic shock syndrome is basically caused in vaginal and nasal tampon using and food poisoning is caused when there is improper food storage or poor hygienic conditions. In the pyogenic categories, there are further two categories, localized and disseminated. Localized infections include various skin and soft tissue infections that are impetigo, carbuncle, furuncle, surgical site infections that are most common when there is poor skin hygiene and when there is no aseptic cover and no antibiotic cover following surgery. In disseminated infections, there can be endocarditis and sepsis that are most common in IV drug abusers. So the diseases of Staphylococcus epidermidis is basically pyogenic. It causes various infections and implant sites. For example, at IV catheters, it can cause endocarditis at prosthetic valve. It can cause renal implant infections at joint sites. It can cause osteomyelitis. And the diseases of Staphylococcus saprophyticus is basically urinary tract infection that is common in sexually active females. Mode of transmission of this bacteria can be by direct contact with the skin lesions, by indirect contact, for example, with the use of fomites in case of poor hygienic conditions, by airborne droplets in case of cross infections, when there are various other bacterial infections, and there can also be asymptomatic carriers. In that case, nose is the most common site of colonization of Staphylococcus aureus. So here is the summarized form of this three species. So here is an again summarized form of three species where Staphylococcus aureus is coagulase positive and the colonies are beta hemolytic on blood agar. Important virulent factor is protein A, and important diseases, as we have discussed earlier, are pyogenic and toxigenic, while the other two species are coagulase negative and non-hemolytic on blood agar. Their differentiation is basically on sensitivity to novobicin, where Staph epidermidis is sensitive to novobicin and Staph saprophyticus is resistant to novobicin. Lab diagnosis of Staphylococcus aureus include: on microscopy, they are gram-positive cocci arranged in grape-like clusters. Biochemically, they are catalase positive, coagulase positive, and DNase positive. On culture, they are beta hemolytic on blood agar, and their colonies are golden color due to the production of staphyloxanthin. Mannitol salt agar is another agar that is a screening device for methicillin-resistant Staphylococcus aureus. Here we can also do PCR for MEC-A gene of Staphylococcus aureus. While the lab diagnosis of other two species include microscopically they are also gram-positive cocci, biochemically they are coagulase negative that differentiate them from Staphylococcus aureus, but they are catalase positive, that is a common factor in the three species. On culture, on blood agar, their colonies are beta non-hemolytic and white colored colonies. Their differentiation is basically on the sensitivity to novobicin. where Staph epidermidis is sensitive to novobicin and Staph saprophyticus is resistant to novobicin, and mannitol fermentation, where Staph saprophyticus ferments mannitol while Staph epidermidis does not ferment mannitol. There are various treatment options. Firstly, there is beta-lactam group, but mostly this bacteria is resistant to this group. So a combination of beta-lactamase sensitive penicillin, that is amoxicillin, and beta-lactamase inhibitor, that is clavulanic acid, can be given. In case of methicillin-resistant Staphylococcus aureus, the treatment of choice is vancomycin or daptomycin, while in case of vancomycin-resistant Staphylococcus aureus, the drug of choice is daptomycin or cunipristine-deflopristine combination. While the urinary tract infections caused by Staphylococcus saprophyticus can be treated with trimethoprim sulfamethoxazole group or quinolones, for example ciprofloxacin.